I know you are a student, so what got you involved?
So I was in my city working in construction, working in a public health institution.
What city was that?
Salvador, Bahia, in Brazil.
Okay.
It's northeast of Brazil. And I was coordinating a program of training for construction workers there. And I had contact with people from the university, my university there, Federal University in Bahia. And they have a connection with UMass Lowell, and I came here to do the doctoral program. And I started to work in the project with Professor Eduardo. And because construction is one of the most frequent jobs that Brazilians goes to work, and I was working in construction in my state, in my city, I was interested to study more about construction workers. And so I started to go to job sites to identify the hazards. I started to do outreach with the community to talk about hazards in construction and to do some awareness for them about the hazards. So I started to work with him in the Cobweb project.
We're going to be back in just a moment. We're going to take a short break and we'll return with Brazilian immigrants improving their working environment. Thank you.
We're here with Elisa Garibaldi from the Cobweb Project, and I'd like to ask you, what is the mission of the Lowell Community Health Center?
Lowell Community Health Center provides caring, culturally, and quality services, health services to people of Greater Lowell, regardless their financial status.
How did you become involved with the Cobweb Project with Eduardo?
I have been working here at Lowell Community Health Center for about, I can say, 4 years. And I was working, my background, I'm a physician in my country, and I started working here in 2002 as assistant, medical assistant, and helping with translation. And one of the members of the Cobweb Project left, so they invited me to join the team. So I met Eduardo, Tiago, who is a doctor too, and we started working together.
And what is the mission of Cobweb, and how do you participate in that?
Well, the Cobweb was created, trying to bring more information and orientation to the Brazilian workers, the Brazilian immigrant workers, because we saw in 2002 that 12% of people who died in the workplace were Brazilian. So we start giving information, trying to show them that they have their rights, independent, if they are documented or not. But the most important, they can have prevention. They can avoid accidents and lesions in the workplace. So we start to, and another goal for our project is to try to link Brazilian immigrants to the health system here in the United States. That is totally different. So with this project, we're trying to approach people and link, these people, to health services here, to have a primary care here too.
Okay, so most of these people were dying just accidents at work?
Yes, 12% were, they died in 2002 were Brazilian. Last month we graduate 8 members in the community as promotores da saúde, which means they are working, they are peer leaders in the community helping with health promotion. So I can say it's it's like a Cobweb is living a son. We have a son. Something came after Cobweb, because with the radio program, with the articles that we do, we write every week in the Brazilian newspaper, we start, bringing more information, and people is coming to us looking for help, for answer for all the questions that they have. And like I said, we have already 7 people, and we are going to have a next training next month. So we're going to have more people who are going to be able to help the community with information about health services, how to access the health services, how to be seen by a doctor, and what is the best way to communicate with the doctor. So I think that the Cobweb is ending this year, but the information was given and made people think about the situation. So I can say that right now we increased our numbers of Brazilian patients here at the local community health center. Right now we have 8% of the patients, like I said, we have Brazilians. In our staff, when I started years ago, we were about 2 or 3 Brazilians. So right now we have many Brazilians working here, and we can say that it's the third, or maybe between the third and the fourth language more. Many people speak Portuguese here today. So I think Cobweb is ending. It's the last year. However, the future, we can see the community with more information, like a community with a better conscious about, their rights. And oh my gosh, forget about it. You can cut this.
You won't even really be able to hear it, because it's a condenser mic. It's not going to really pick that up.
No, because